All right, let's call this meeting to order. If it's 9:16, let's call this meeting to order. I'm Kay Leach, Celinda K. Leach, and I'm serving as chair for the Board of Health. I'd like to introduce the board members today. I can't see them on my screen, but if they would please raise their hand. There they are. If they would please raise their hand as I call their name. Ashley Cranner, I'm sorry, Ashley Cranner. George Hegeman. Is George here today? Do you know if he's coming on board, Penny?
I believe so. I think Dr. Pritchard was the one that I knew could not be here. Dr. Hegeman may have a conflict for a portion, but I believe he should be here.
Okay, well, hopefully he'll be joining us shortly. Mark Norrell.
Present.
Carol Talukian.
Here.
And Robert Wren.
Here.
Also with us today, we have our administrator for the Monroe County Board of Health, our Department of Health, Penny Cottle. Penny.
Good
and
morning.
we also have with us Dr. Tom Sharp, our health officer.
Dr. Sharp, he is on his way, and I just saw Dr. Hegeman come on board.
George, would you like to kind of give a wave? We introduced you, but you weren't on yet. Can you give a wave and let people see who you are?
Hi, my name's George Hegeman. I'm a retired member of the biology faculty at IU, a microbiologist, and I've been on the health board for many, many years.
Thank you, George. And also with us today, we have Margie Rice, who's our legal consultant. Margie, thank you for being here.
Morning. Thanks for having me.
Okay, first of all on our agenda is public comment. If there's anyone out there that would like to bring an issue to the board or a statement, if you would please raise your hand at the bottom of the screen, we'll recognize you. Okay, we have a hand that's been raised by Scott Reynolds. Scott.
Yes, thank you for recognizing me and the opportunity to speak before the board this morning. First, I just want to thank everyone who's obviously been putting in a lot of work throughout this pandemic in order to figure out the best way for Monroe County to address it. I'd like just to speak today generally in opposition to a renewed mandate. I'm going
Scott,
off.
you're a little bit low. It's hard for me to hear you. I don't know if other board members are having trouble or not.
I can try to speak up. I don't know that I can change it otherwise on my computer. Am I better now?
A little bit.
Okay, well, I'll try to speak really loud. Thank you for your patience. I just wanted to,
Okay.
One of the things I'd like to.
Scott,
Yes.
are you still there?
Hey, I can hear him fine.
I can too.
Okay, you may need to turn your speaker up on your computer.
Should I go ahead and proceed?
Yes, please.
Okay, thank you. I've reviewed the draft order, and I'm concerned that there's no articulated end game to this order. I've not encountered any reasonable public health authority that's indicated that zero COVID is an attainable goal. And thus, I believe that any mandate should be based on a concrete goal that is attainable. Unfortunately, at least as far as the current draft order is concerned, it doesn't articulate such a goal, and also fails to provide any evidence or data regarding the foundation for the order, stating simply that it is being put in place due to the concern about how COVID variants are affecting Indiana and Monroe County residents. This statement doesn't even gesture toward actual data. So I think reasonable questions that we might consider are, what is our county's ICU or hospital bed utilization rate? Are we nearing or exceeding capacity? How frequently are county residents experiencing severe infections or even fatalities? How does this compare to earlier periods in the pandemic? I'm sure this data has been discussed, but it's not on the table for the public at this point. Instead, the decision appears from our perspective to be being made based on more of an emotional response or desire to appear to be doing something. And I would just like to articulate that I think we deserve more than a knee-jerk reaction, and we should recognize that Monroe County is not by itself in this state. We can do things, but our ability to affect the entire state is limited. If absent no mandate at all, I would at least ask that the order be revised to put an end date into place rather than just saying it's any time that Monroe County is in an advisory category that is not blue. That just offers the opportunity for whiplash effect if we are sort of hovering between blue and yellow. I also suggest this would permit the commissioners to have better oversight. And then finally, and perhaps most importantly, as a business owner, I would request that there be another enforcement mechanism other than putting the burden on businesses' employees to be the sole enforcement mechanism. This has been a very stressful thing for our employees in the past. And I see, we already saw issues with compliance among the public before the previous order was lifted, and it's hard to imagine that that's going to get better. And it just puts so much burden on our employees. I have no problem asking our employees and requiring our employees to follow the mandate, but it's another thing entirely to ask them to be the sole enforcement mechanism. So that's all I had to say this morning. I just appreciate the opportunity to speak. Thank you again for your work.
Thank you, Scott. Next, I see Graham. I'm not sure how to pronounce your last name, Graham, but I see.
Hi. No worries. Can everybody hear me okay?
Yes, we can.
Hi. Thank you for giving me the time to speak again today. I'd like to speak in opposition of re-implementing the mask mandate. First and foremost, I believe that it'd be a punish the vaccinated mentality. The vaccinated have done their part on what we can do, and why should we have to put the mask on when the only people that can get seriously sick are the unvaccinated? Those individuals made the choice not to get the vaccine, and the vaccinated should have the option whether to weigh whether or not they want to put on a mask. The health department needs to recognize that there is a possibility that these unvaccinated will never get the vaccine, and that the number may not tick up much above the 50 odd percent that we're at right now. I call it a punish the vaccinated mentality because according to a chart that was posted on Twitter by the Monroe County Health Department, there's a 0.077% chance of a breakthrough COVID case for somebody that may have COVID that will test positive for COVID that has the vaccine. Just 1 month ago, Penny Caudill, County Health Administrator, said the answer really is that we just need more people to get vaccinated and that we don't need a mask mandate. I believe that still remains the case today, and we should not go back on that. The average cases per day are 58 per 100,000, according to the Indiana State Health Department. The CDC would barely classify Monroe County as substantial, as being only over by 8 cases. I don't believe that this is the time to implement a mask mandate by barely being over in a category by the CDC. This virus will never fully go away. As Mr. Reynolds stated, 0 COVID-19 cases is not an attainable goal. Our county is doing much better counties in the state, and I think we should be proud of that. I think the average is much lower than other states, and like New York, where their Monroe County had over 200 cases last week and are not implementing a mask mandate. In terms of what was proposed, the PAC requires that masks are required, quote, anytime Monroe County is in a yellow, orange, or red advisory category. That's a little confusing because I don't know if we're going off the Indiana State Department of Health category or the CDC, because they both have two different colors. Well, they both use the same colors, but it's not specifically stated whether this is following the CDC or Indiana State Department of Health. If a mask mandate is reinstated, will this be revisited at the end of each week as these maps are updated? If this will cause mass confusion because of people and businesses constantly needing to check whether they need to have a mask, and will cause kind of the back and forth, as Mr. Reynolds also alluded to. We must acknowledge the mental health toll that this pandemic has also taken on people, especially young people. I have 2 friends that have died from drug overdoses during this pandemic because of the toll that this pandemic takes on them. And these 2 cases are just thousands during the pandemic, that have gone largely unnoticed. Finally, I do not want to see the division that masks and COVID-19 caused a breakup in our cities and our county anymore. The virus, the masks, and vaccines have become political, even though they were not intended to be so. Masks especially have become a hot button issue in our state, and the governor disagrees with what has been announced as the plan to do so this week. We all saw how poorly the mask mandate went in Monroe County after Governor Holcomb ended the mask mandate for the state in the spring, yet Monroe County kept it. It created yelling fights among people that I personally witnessed in our place of business, with what Mr. Reynolds alluded to as being a business owner he experienced as well. I ask you to please not cause more division among fellow Hoosiers, and to not re-implement this mask mandate and let businesses and the like decide whether or not to require masks. Thank you.
Thank you, Graham. Jeff Hauser? Jeff, are you there? Jeff, you're muted.
Okay, I'm unmuted now.
No, you're
All
fine
right.
now.
I just want to be speaking up in opposition to this. There has been tremendous confusion, but we as the vaccinated people do what you guys say. We get vaccinated. Now the vaccine don't work. It's been said the masks don't work, but now they're saying, well, now the masks do work, and so it's a control issue that somebody is wanting to be in control to tell. If the mask work, my point is, if the mask works so well, the people that want to wear a mask, we don't criticize them for having a mask on. They're protected, but you guys on the county say, well, we're not the ones that are, we're being inconsiderate to others. Well, why are they not being considered inconsiderate to us? Because we want to have freedom of choice, and the information is not clear. Dr. Fauci and all these ones up at the federal level have been found to say that masks do not work on this. But now that this is wanting to be what the county is wanting to do is step 1 of trying to shut down businesses again. They're wanting to go into a lockdown, but they're hiding behind, well, we want to start out, and it's a fear-mongering thing that people have just now started to come out. Businesses are struggling to still get people to go to work. And I just think that the county, you guys, I hope and pray, will stay in opposition to this mandate and allow us to choose as individuals of Indiana and Monroe County, and let the businesses and churches and those kinds of things. I haven't looked over your order, but it don't look like there's any end to it. And it just seems to me like the mayor is asking for an overreach of something that he's trying to cause panic in a place that there's not a need for panic. And, if it was proven that masks worked, then, you can always go find somebody that's going to say it, but they've been all over the place on it, and there's no substantial thing that they can say. And then they want to say, well, everybody needs to get vaccinated. And I've seen the mayor's report saying because people don't get vaccinated, we got to put masks on. But now it's, well, if you're vaccinated, you still got to wear a mask. So basically the masks don't work, put a mask on. The vaccine don't work, but you're wanting people to get something that don't work. And I just think it needs to be people's choice, and let the county stay open, let the people choose. And we don't shame anybody for wearing a mask if they choose to do so, but we should have that right to choose. And I just thank you for allowing me to speak this morning.
Thank you, Jeff. Is there anybody else that would like to bring a comment to the board? Okay, next on our agenda is approval of health order and regulation. Penny, I'm going to turn this over to you and Margie.
Okay, let me start with just a little bit of numbers, kind of where we are today. Things have changed a little bit from last week. So I'll start there just with a little bit of that data. So this week's metrics map, and all along we have been using the state's metrics map. The one gentleman noted that, you know, the different trackers and things, they are different. So this order, we did use the state's, that blue advisory that we were talking about was really referring to the state. And there was a reason for that, and that's because that's what we've been using. But I do want to note, and I'll talk about this in a minute, that it is a little bit different from the CDC tracker. This week's metric map, we went from blue to yellow with 58 per 100,000 cases and a 6.91% positivity rate. The week before, we were still in blue. We had 51 cases per 100,000 and our positivity rate was 4.56%. We remained in blue because that percent positivity was below 5%. With the CDC's tracker and what they are referring to in terms of substantial risk is anything over 50 cases per 100,000. Forecasting, looking at this week and next week, our numbers are rising. I have not gotten final confirmation. It's still early. We're expecting to get our numbers for this week. I think we may squeak by and stay in yellow this week, but if the numbers continue on the same path that they've been, I would expect us to be orange in the next week or so. I don't know that. I hope that that is wrong, but just looking at the numbers as they're coming in. So based on the case and positivity rate, I would estimate that it will be over a month before the advisory map returns to blue. And if you wanted to add 50 cases, that it also had to be 50 cases or below, kind of giving that CDC number, then it may even be longer. So adding a date to it, it was mentioned that maybe you also add a date. You probably would be looking at mid to late September before we would reach that blue level, considering where we are now, where we would reach that blue level and probably 50 cases per 100,000 or less. Now, that's an estimate. When this was written, the intent was to say that, again, when we're back in blue, this order would end. So there isn't a back and forth. This order would end. And if I am wrong, legal is here and they will correct me. Then if the numbers changed and you decided that you wanted to reinstate a regulation, we would be again going through this process. So if the numbers again went up, then we would have to revisit this. You would have to approve it. And again, it would go back to the commissioners, because with Senate Bill 5, any of your regulations about this will, because they're more strict, will have to be approved by the commissioners. The other thing that this order is doing is following CDC guidance, which is included for fully vaccinated. And I certainly do hear very much the concerns for those who have been fully vaccinated and kind of are concerned that they have to start wearing masks again. But the updated guidance for fully vaccinated people recommending that everyone wear a mask in indoor public settings in areas of substantial or high transmission, regardless of vaccination rate. And some of that is dependent on, we know that the vaccines are not 100% effective. So there will be people who have a breakthrough case. And the Delta variant is showing that people can still transmit it if they are infected, even if they were vaccinated and have a mild case. So the CDC statements Delta infection resulted in similarly high COVID-19 viral loads in vaccinated and unvaccinated people. So if you are one of those few breakthrough cases, then you still can spread that infection. High viral loads suggest an increased risk of transmission and raise concern that, unlike with other variants, vaccinated people infected with Delta can transmit the virus. Masking recommendation was updated to ensure the vaccinated public would not unknowingly transmit virus to others, including their unvaccinated or immunocompromised loved ones. We are seeing our cases. If you look at the dashboard, you can see that cases in Indiana and Monroe County are going up. In Indiana, there are now 5 counties that will be in red based on positivity rate. There will be 11 counties, I believe, that will be red based on cases per 100,000. In terms of breakthrough cases do remain a very small portion of the fully vaccinated population, although we are seeing some increases in that. 0.126% of all fully vaccinated individuals have become a breakthrough case. So 98% of the cases since January have occurred in those who were unvaccinated. And the last thing, we're in this month, right? We're just into August. And I'm not sure this data, it says in current month. So take that. So far, the Delta variant has been 100% of all the samples that have been tested. Now, I say that, I want to be really clear, not every specimen is tested for variants. It is a sampling of them, but it is an indicator. We use that surveillance method for lots of things to see what's circulating. Delta update, people infected with the Delta variant carry up to 1,000 times more virus in their nasal passages than other strains, and that's what's resulting in the higher transmissibility, even among the vaccinated, even though that's still small. CDC says that fully vaccinated individuals may spread Delta variant at the same rate as those who are unvaccinated. So those are the things that we've used, among others, to draft this order and to follow CDC guidance. So I just wanted to start there with some of that. And then I'll kind of go through the draft order, and we can make any changes that you want to make to it, and then you can vote on whether or not you want to approve it. Could we perhaps post it, show it, tech services? Thank you. So this indicates that the Board of Health are meeting today to look at this, to approve it. So if you were to approve it, then it would move to the commissioners. And hopefully when we can also hear from them before you take any vote and see what they are hearing from individuals as well.
Before we do that,
Yeah.
Is it possible the board members can respond to some of the concerns already that before
Sure.
we get to the voting process? Because I think there's some things that I would like to address that some of the public brought up.
Absolutely.
Is this a good time?
As good as any for me.
And
Okay.
I might recommend that TSD take down the draft order while board members are talking so we can see everybody a little bit better.
Great.
Great, thank you.
Thank you. So I think the concerns that the public have are legitimate. I have concerns too about enforcement, and I think that it does put a lot of onus on the business owners. Nowhere in the ordinance does it state anything about posting signs, which I think we've had before, which I think would be, I mean, I think that's an easy thing to do that doesn't disturb their business at all. And I think that we should have a little line in there saying that, you know, that they need to post signs saying that masks are mandated, so that you don't have to be harassing people on the way in the door. I have a lot of empathy for it. The enforcement thing, my feeling is when they got rid of the mask mandate for vaccinated people, that it would just screw everything up, which it did, because that means nobody was wearing masks, because it's very clear that unvaccinated people also stopped wearing masks at that time, because 100% of our population wasn't vaccinated, and there were like one person in Kroger with the mask and everybody else was without masks. So I don't think all the unvaccinated people are staying home. So I agree with the part about, you know, if you're vaccinated, you know, I got vaccinated to protect myself and other people, not necessarily not to wear a mask. I wear a mask anyway now. I mean, I wear a mask. I still wear a mask. But it's very clear that masks do work to prevent spread. That's very clear. Very early on, they suggested not wearing masks. That wasn't because they didn't work, it's because they didn't want people going up and buying all the N95s and not having healthcare workers have it. That's why. And so they didn't, the masks weren't recommended till later because of that, not because they don't work, because they clearly do work. I mean, I'm a physician, I wear masks in the operating room. I wear masks when I'm doing, you know, anything that involves being that close to people. So, I mean, it's very clear that masks work. We know they work we've used them in healthcare for hundreds of years. The vaccines clearly work to prevent serious disease and death, which I personally would like to avoid. It's very clear that vaccinated people, like Penny said, can get the Delta variant. The Delta variant is scary. I mean, it's much more transmissible. It's much more severe. And I think that we should take it very seriously. It's not like the early COVID. It's a very scary variant, and it can cause a lot of disease. And it's very clear that unvaccinated people transmit it much more than vaccinated people. But you know, I'm going to wear a mask because I don't want it to accidentally transmit it to somebody who's vulnerable. And that brings me to the vulnerable population, which is our children. Kids under the age of 12 are not eligible for the vaccine. They've already missed a year of school. I'd really like to be able to have our kids in school so they can not get any further behind in their education. And if there's any population that deserves to be protected, it's our children. And so I have absolutely no problem with the mandate. There are some issues, I think, and I feel really badly for businesses, I really do. But I really want to protect our children because I want to be able to keep them in school so they can actually not lose another year of school, which they already have lost. And so I support the mandate, although I do think we should put something in there about hanging up signs. That'd be my only change I would add to it. I'm done.
I'm sorry, Carol, could you repeat that? Add something? I lost what you said.
A line about have signs posted at the entrance to say that there's a mask mandate.
Thank you.
And again, that's just to help the business owners make it very clear that there's a mask mandate. And again, I have a lot of empathy for the business owners and in terms of enforcement. And I don't want people getting in fights over it either. I don't think it's a good idea to confront people. I think it's important to make it very clear that we as a population think it's important to wear masks in public to prevent the transmission to me and to other people. Well, from my standpoint, mostly other people, because I want to protect other people. I do, and I can choose not to go places I don't want, but if I'm out, I do want to protect other people. So that was my suggestion. Just add that one little line.
Thank you, Carol. Any other comments from board members? Mark?
Yeah, so thank you for the public commenters that came on this morning. And one of the commenters talked about an articulated end game. And I think that is a really super suggestion that we put in there some specific benchmarks for when we're going to when this might be rescinded and when we come back and reevaluate it. And, Penny, I think, suggested or mentioned a 2-month horizon. So I wouldn't be opposed to putting in a solid end date, that this sunsets at the end of September, September 30th. That would be acceptable to me. Also, I think putting it in, putting criteria in that could be reached prior to September 30th, such as less than 50 new cases per 100,000, or that we go into the blue level as a county. I think that in either of those circumstances, this could automatically sunset. So that's something that I wouldn't mind considering. I want to echo also what Dr. Tolukian said about, one of the commenters said that this is punishing the vaccinated, but that ignores the fact that the vaccinated can carry a high viral load and pass it on. This is new knowledge that we have, within the past 4 to 6 weeks with the Delta variant. This is not punishing the vaccinated. This is public health concepts. Now, a question that I would have for commenters out there is, what's the alternative? I agree that the vaccinated really shouldn't be, quote, punished, but what's the alternative? Because we don't have a way, we don't walk around with something stamped on our forehead that says I'm vaccinated, right? And there's no way, I don't know what the mechanism is to require masks for unvaccinated people, because that just cannot work from an implementation standpoint. So I'm not sure what is the alternative to a universal mask mandate, besides just saying no mask mandate at all for anybody. I don't know what the alternative is to that. And we're now in a high risk time, and it makes sense that one of the commenters said that this is an emotional response. And I think that you heard from Penny data, and you hear all of us speaking in terms of data and data driven, which would tell you that this has nothing to do with emotion. Thank you.
Thank you, Mark. Any other comments from board members? I think we're talking about the Delta primarily right now, but we must remember that one of the reasons we do recommend wearing masks is because these viruses are mutating all the time, and they're after Delta. What other mutation are we going to see that's going to become the main one we'll be talking about again? So I think Delta is the one right now we're talking about, but we want to stop the spread. That's the reason we're talking about masks, is to stop the spread and hopefully stop some of these mutations that occur. Would the county commissioners like to voice anything about comments they've received?
Hi, this is Julie Thomas.
Julie?
We have, thank you. We have heard from constituents, also from IU as well, about the same things we've heard today, and also some support for reinstating a mask mandate to protect those who are unable to be vaccinated. And I think one of the things I'm curious about is whether there's any need for any other assistance that the county commissioners can provide, as we have in the past. So that would be my only question for the board.
Julie, I'm glad you brought that up, because I know when I read the order, the first thing I thought about were the business owners. And I also have empathy for the fact that they are becoming policing the public. But I think one of the things that really seemed to help when we went through this last time was compliance officers. And my thoughts would it be possible that we could have compliance officers again to assist the business establishment? How do the rest of the board members feel about that?
I thought the compliance officers were great. I hope we could have them again, because I think that we got a really good feedback from businesses about taking the pressure off of them. And I really would support doing that again.
I agree.
Yeah, I second that.
I agree too.
Is that something, Penny, that is doable quickly?
Well, we would have to, they're not under contract right now, so that would have to be renewed. I don't think that that would be a difficult task. The commissioners covered that cost, I believe, with CARES funds. So I would defer to them in terms of finance for that. But I think that's exactly why they are asking that question, if that's something that we would want. And certainly a couple of things that I had noted, and again, businesses, that is probably one of their biggest concerns. And Dr. Talukian, I'm glad you mentioned the signs too. That was something that I was going to mention, and something that one of the business owners pointed out. And we had that in one of our early requirements. Our initial requirements was that they needed to post a sign to wear a mask. So certainly I think that that's an easy add to this order, to make it very clear, maybe at the entrances to, that those signs have to be prominent and clear about what the requirement is. We did get good feedback, and certainly it is difficult. I think that businesses want to be compliant. They want their staff and their patrons to be safe, and the challenge becomes with people who are the few who are unwilling to be compliant. And we've heard businesses and employees and people getting in altercations or arguments because people are unwilling to put that mask on. I do think that clear signage kind of helps. It's clear that this is the expectation. And I think that the compliance officers do help. Certainly the compliance officers, health department staff, none of us can be in every business 24/7. So there's no way to be there all the time, but I do think that it offered some assistance to businesses. And I would say that what we practiced before and what I would anticipate us still practicing as we follow up on complaints or issues is how is the business trying to comply, and what's their level, are they doing everything that they can within reason to comply with that order? So that would be the thing that I would say about that. We do have window clings. We can do more signs. We sent signs out to businesses before. We can resend those. We can do new ones if they would like new ones. So we can continue to assist with that.
Are we ready to see the order on the screen, Penny?
Sure. A couple other things that I will note. I think I've shared these with you, but just for public awareness too, some other questions that have been raised. We've had some churches ask if this applies to them. The answer is yes. We want to treat churches and businesses and all public facilities the same. That we did include the exemption for presenters and people who can be 6 feet apart. And that actually was part of that conversation. That was something that we had talked with churches about earlier when we had the mandate. And then schools, we kept this, and I'll go through the order in a minute, but I just want to kind of clarify where we were coming from. Schools, we really kept that pretty similar to what was in our previous order as well. And part of that was that the regulations sometimes differed slightly from what school guidance was based on CDC or the Indiana Department of Health. One example might be that they need to wear masks, but they can have mask breaks, or they have to be worn in these classrooms, but not these classrooms. And so we really deferred those to CDC, Indiana Department of Health, Indiana Department of Education, and then in consult with us at the health department, just based on what's going on in our community. I have had some schools ask about, can that be, or should that be actual mandate, so that all the schools K through 12 are required to follow masks as well. So that could get a little trickier if state or CDC guidance is different than wearing them indoors all the time. But that is something that I will share with you that came up because right now the governor's order is that school boards determine what their prevention policies are. And then I think that that's it. Collegiate, that is kind of state property. In general, we have not regulated that. However, you know, it'd be like us regulating DNR. We don't regulate that property. But I do know that IU is discussing, and they meet regularly to discuss all of their policies and procedures around masks and other prevention strategies. So I know that they are discussing those things now. So and then the other thing was questions and businesses ask about assistance for businesses and enforcement. So you've already addressed the desire to do that. So I think that those are sort of some of the comments, and we can kind of go back through that order unless anybody else has a question or a comment.
Our
so
big
again,
concern on the Board of Health is your health. The health is the issue here. Obviously, it hurts the businesses, but we want to help the businesses provide good guidelines so we can maintain good health. We've been hit with the virus. The virus got better with the vaccines, the masking. A variant came along. We've got to work our process again, and we're doing it for health reasons. And I hope you appreciate what Penny does and all the other members do to try to keep the businesses up to speed.
I endorse Bob's comment, and in fact, it's beyond ironic that through willful ignorance and I guess basically an absence of knowledge, that we have a new virus, and the people who have refused to vaccinate are the ones who, at least in part, have helped give rise to this new virus, and possibly will for others in the future. So if we're worried about consistency in rules, it should be pointed out that we're dealing with a really new situation, and we should try to avoid dealing with similar new situations through vaccination. And that's the main and most important tool we have at hand.
and Penny Giffens, Commissioner Giffens has her hand up.
Thank you. I wanted to say I really support the signage. One of the things that Ms. Cottle pointed out last week at the Board of Commissioners meeting was that surrounding counties have a much higher incidence rate. And those are people that come to Monroe County to work, to dine in restaurants, to recreate, and even some of the kids come here to school. So I think that when we don't have a border where we can keep only Monroe County residents exposed here. We've got a lot of other people that come through. And so having that signage and having this in place, I think will really be important for the health of the county. Thank you.
And if I could interject just a couple of things. Dr. Wren talked about our process and that we have to work our process again. I would like to point out that our process has changed a little bit since the last time with the introduction of Senate Enrolled Act 5, which does require the local order passed by a health board to be confirmed by the local legislative body before it can be enacted. It doesn't take effect. Whatever you vote on today will not take effect until it's passed by the county commissioners, who are a legislative body. Similarly, enforcement actions have to be approved by the commissioners. That's also part of Senate Enrolled Act 5. So this board will be working much more closely with the commissioners as we move forward in terms of what is ordered and what is enforced. And so I don't think he's on this call. I don't see him on here. He may be, he may be hiding. But Jeff Cockrell is another county attorney. You know, Monroe County attorneys represent the county of Monroe, and we have various constituencies within the county, like the county council, the county commissioners, the board of health. So we will work together to make sure that we are representing Monroe County and its orders, those passed by the Board of Health and confirmed by the commissioners. So I want you to know we'll work together with that. The question came up about, could we have enforcement officers? Legally, that will require a contract. Well, contracts are approved, service contracts are approved by the county commissioners. So if the county commissioners pass a contract with an enforcement agency like we had before, maybe the same agency, and that contract is funded by the county council, then that's certainly something we can do again. And we did have good results. They definitely took an educational approach to working with the public. One thing I might suggest that we add, in addition to the language about the signage, and I was taking notes here. We might, and you know, if I think you should talk about a sunset provision. That's an excellent suggestion from the public, and I know that Mark Norrell talked about that. I think that that's something that would be wise to put in. Again, Mark's suggestion was sunset on September 30th, unless you meet a benchmark earlier, such as you drop below 50 cases or you go into blue. That is something I'd like the board to talk about and consider. And again, get some feedback from the commissioners, because what you pass has to be approved by the commissioner. So we want to make sure that everybody's sort of on the same page. And this board might think about how often you're going to meet. You know, as somebody said earlier, things change quickly. This virus is mutating. It's you know, who knows, you know, how things are going to change as we move forward. So this board might want to think about how often you want to schedule meetings, and if you want to schedule those on Tuesdays so that, you know, then the Board of Commissioners can react on a Wednesday. That may be helpful. I also would just like to point out that there was a comment in the chat about, is there a way to find a new way of encouraging the vaccination? As one of our public commenters pointed out, that the New York City Mayor has suggested that we find new ways of encouraging a vaccination, maybe a carrot rather than a stick. Don't know if that's something you want to talk about as well. So those are all things that I think you should think about before we move forward. And Penny, I don't know if you have any comments about specifically about an enforcement contract, if you would like to use the same agency, if you'd like that to happen sooner rather than later.
Well, we certainly had, whatever the process for that, we certainly had good relationship, and they seem to work well with our businesses. So we did get good feedback on that. And I think in hearing from the board, I think that from the board and perspective, and from speaking for health department staff, it certainly was very helpful to have that assistance in offering help to our businesses.
And they have a little experience behind them on how to deal with and knowing the public, or knowing the business owners.
Yes.
if we approve this order, would it be appropriate to have a separate motion for contracting for enforcement? Would that be a separate action today?
Yeah, I would recommend that you take care of the order and then separately somebody propose to recommend that to the commissioners. Along with that, we had language in previous orders, and we can add it to this one, that says nothing in this order gives a private individual the right to harass another individual because they aren't wearing a mask. That is something that we certainly do not want to encourage, which is, people taking this into their own hands for enforcement. So we can add that language. And then I think, as you say, Mark, after this order is approved, if it is approved by this board, then you can take up the issue of enforcement.
Okay, Penny, anything else? You're muted.
Sorry
Penny.
about that. Just kind of going through the order. Again, this is really just following the CDC guidance for all people to wear masks when they're in indoor public places. We used as much language from previous order as possible, and at the same time adapted to what the specific situation is right now. We do have exemptions. We went through the previous exemptions that we had. So masks are not recommended for people who are 2 years of age or younger, individuals who are hearing or speaking impaired, and for whom a face covering is an obstacle to communication, individuals who are unable to wear a face covering for documented physical, medical, or health-related reasons. If you're in a doctor's office, a dentist's office and such, and you can't get the care you need because you have that on.
Can we put that order up on the screen for people to see, Penny? As you go through it?
Yeah, tech services will do that for us, yes.
Okay.
Yeah, great. So just that number one, so this would, according to how it's written, this would assume that the commissioners approve it tomorrow at their meeting, and then it would take effect at noon. Certainly that, could change if you wanted to do that. This first piece, so let's just take this. I'll point out kind of some of the things that we've talked about. So unless an exemption is stated in paragraph 2 below, applies anytime Monroe County is in yellow, orange, or red advisory. So that would be the state map. We've already talked about this could, very clearly state that it could include that the cases per 100,000 must be 50 or below, and that, perhaps it would then sunset if those benchmarks were met. How it's worn, what constitutes a face covering is really from our previous order that we wrote. And then below that, we have the exemptions. So when we go down to 2, so again, I mentioned children under 2. I'll kind of hit the highlights if we can scroll down. Yeah, that's good. That's good. So doctor's offices, we got that. So E, we looked at what we had used before as well. So individuals who are alone in a room in a public building, such as an office, or in a workspace and physically distanced from all other coworkers, or making a public presentation and are able to maintain 6-foot distance away from others. So that 6-foot distance again came into if you were in church and you were preaching, if you were making a presentation, if it were the commissioners talking to a group of people, whoever is making that at a press conference, say, whoever is speaking could remove their mask during that time, as long as they're distant 6 feet away from others. And again, we kind of took that from a previous order that we had.
Penny, when I saw that, one of the things I thought about was I would like for it to say individuals who are alone in a room in a public building or on public transportation.
Well, public transportation is required, so that is not an
Okay.
exemption. That
Okay.
yeah,
All right.
public transportation is a requirement already. Yes.
I was speaking as a requirement, and I forgot for a second we're on exemptions. Go ahead.
Yeah. Certainly, if it presents a risk to somebody's safety at work, or workplace safety regulations, individuals who are incarcerated, individuals who are engaged in a form of indoor exercise that is incompatible with wearing a face covering, including swimming, individuals who are seated at a restaurant, bar, or other establishment that serves food and or drink, and who are actively eating or drinking. So, however, individuals entering and exiting restaurants or bars, or congregating in waiting areas or common areas of restaurants or bars, including bathrooms, must wear face coverings, or a bona fide emergency situation. Again, most of these had very little, if any, changes from previous orders that we had. And then the final one was schools. Again, this is from number 5. Is similar to what we had before. We do have some notes in there in terms of what we would recommend people do, but not an order. Number 5, for academic and extracurricular activities in K through 12 schools in Monroe County should follow the guidelines of the CDC, Indiana Department of Education, Indiana State Department of Health, and it's recommended that Monroe County schools consult with, and all Monroe County schools, not to be clear, that's not talking about a specific corporation. We are talking about Monroe County schools within Monroe County should consult with Monroe County Health Department regarding best practices based on current local conditions. Schools may adopt rules or regulations consistent with these requirements. Again, we did have at least one school ask about why it's kind of a should and not a mandate that all schools require masks. And the answer to why it's written this way right now is that CDC, State Department of Health guidelines have previously differed slightly because they've been tailored to schools. But if you wanted to craft something that required that they must follow CDC or Indiana State Department of Health guidelines, you could certainly entertain that. And I do think that it's a good idea to go back and add the piece about not being that this doesn't give the right to harass somebody. I think that's an excellent idea from county legal.
Board members, discussion?
I don't really have anything to add. Do you want a motion to pass it with some changes?
Sure.
I can make a motion. I can make a motion. We pass it with the following changes. In item number 1, we want to change, put more markers in terms of it when it expires, and it's Indiana State Department of Health graphics that we're using. I also want to add signage and the being required in the enforcement part, and also that it is not appropriate for anyone to harass somebody else. I think we have language from other ordinances we've had in the past, we can just drop in there for that. Other than those changes, I move that we pass this.
I
Just to
second.
be clear, Carol, is your motion, is it the September 30th end date? Or
Yes.
if we hit one of those benchmarks earlier?
Yeah, or if it's appropriate earlier, if the graphics change.
Okay.
Yes,
And-
that's,
And specifically, the benchmark is, you already have, that we have to be in yellow, orange, or red, but the benchmark about cases per 100,000 per ISDH, if they fall below 50, or I guess it's in effect for times when it's above 50. Right? Is that kind of what you were envisioning?
I think what we want to say, I mean, basically we need to be in blue for it to go for it to go down, which means under 5% and less than 50 cases, right? Is that what it is, Penny?
Well, that is a difference. No, the state advisory would not be 50. The CDC marker is 50. So
Okay,
if you
so
want it
what's the state advisory is less than 5%,
less than
and-
5% and under 100.
under
per
100.
100,000.
So we want to say
99 or less.
So we want to say less than 5% and under 50.
Okay.
Is that what we want to say? I see some heads nodding over there.
That would marry you up with both the state and the CDC guidance.
And that's what we should do, because that makes it easy. So yeah, so number one, we add less than 50 per 100,000 and less than 5% positivity rate. And we add September 30th as a expiration date. Agreeing that we're going to meet again frequently before then. And then the signage and the no harassment clause, which I think we can just lift from another one that's been passed in the past. Is that what everyone was thinking? I see lots of nods. So that's my, so.
Sounds good, Carol.
Thank you,
Yeah.
Carol. We have a motion. Do we have a second?
I'll second that.
Okay, we have a motion and a second. Let's do a roll call.
Oh,
Great.
hold
Margie?
on just a second. Do you want to take discussion about that among you? And we did have, just in chat, somebody asked if we could clarify the mandate does not apply to schools. So do you want to still give them that choice based on CDC and Indiana state guidelines? Or do you want to put some
Penny, or do you want to put what? I'm sorry, I missed the last part of your,
I think I just cut my own sentence off myself. Sorry about that. So we had talked about, we put this in there that they would follow, that they should follow CDC or state guidelines because we know that they can be different. But the question has come up in terms of some schools will choose not to do that. And are you okay with that, or do you want to ensure and require schools K through 12 to require masks in classrooms? So.
I think it's a change from should to shall. Is that correct, Penny?
Yeah, essentially, yes.
Yeah, and in the at the end of the order, it currently says for academic and extracurricular activities, all K through 12 schools in Monroe County should follow the guidelines of the Centers for Disease Control, Indiana Department of Education, and the Indiana State Department of Health. The question is, do you want it to say shall as a mandatory, or is it a recommendation? It's currently on the table as a recommendation. So if you want to change it to mandate, then that can be added to Carol's motion by friendly amendment.
I'm
Board
okay changing
members?
it to shall. I'd like to see our children being protected and being able to stay in school. So if there's outbreaks in school, then kids won't be able to go to school. And I just think our kids really we need to do whatever we can to keep our kids in school this year.
Yeah, there was a case this morning in I think it was Louisiana, where 7 children tested positive and 168 are now quarantining. So I'm with you. I don't really want to see that happening here.
I mean, if I had a school-age kid, I would insist my kids wear masks in school. In fact, my 5-year-old granddaughter wears a mask, even if it's not required. She has no problem with it. She is cool with wearing a mask.
I do want to point out this, there's a question in the chat about whether this is public or private schools. Private schools are under the jurisdiction of the Monroe County Health Department, just as public schools are, and our order doesn't make a distinction. So it's applicable to all schools in Monroe County.
Okay,
So I'll add
part
that to my motion to add shall in the last that last paragraph about schools instead of should.
And if I can just make one more comment, I mean, as we know, Indiana made these changes to state law to require this extra process before these stricter orders can be put into effect. But keep in mind the fact that state law still does allow counties to put in place stricter regulations than what the governor has. So the fact that we have additional process is giving, the public sort of more opportunity to comment. Seriously appreciate the comments we've had today. I think they've improved this order. And I would encourage you, again, at the end of this meeting to determine when you're going to meet again. Because if there's one thing that does improve process is interaction with the public and democracy. And so I would encourage you not only to address the enforcement, but to, set another meeting date, in well before the expiration of this order so that you can respond.
Any other discussion on the motion? We have a motion and a second. Ashley, with that change to shall, you still have a second, am I correct? Okay, you're muted.
My apologies. Yes, I accept that.
Okay, so we have a motion and a second. Let's do a roll call. Okay, Cranner,
Aye.
Hegeman,
Yes.
Norrell,
Yes.
Talukian,
Yes.
and Wren.
Yes.
And I also vote yes. Okay, what about or would someone like to make a motion regarding compliance officers?
I'd make the motion that we direct the county health department to contract with the entity that can assist local businesses and others to comply with the health order.
I'll second that.
We have a motion and a second. Any discussion?
I agree.
The only thing I would say, Margie, should that not be that we make that request to the county commissioners?
Yeah.
Yeah, it could be phrased subject to approval by the commissioners and if there's some proper funding for it.
I'll amend my motion accordingly.
Agreed.
And you should
Okay.
appreciate this is to help businesses, not harm businesses.
Okay, ready for a roll call? Cranner,
Yes.
Hegeman,
Yes.
Norrell,
Yes.
Talukian,
Yes.
Wren,
Yes.
and I also vote yes. Okay. Let's talk a little bit about when we meet again.
How soon do you think we should meet again, Margie? 2 weeks? 3
That's
weeks?
what I was going to say. Yeah, I was going to suggest 2 weeks from now. And that will also allow, students are already coming back and we can see how the influx of new residents changes our numbers.
Penny, I have a question. We were supposed to meet on August 9th. Are we still meeting then?
As far as I know, yes.
So that's 1 week from today.
Mhm.
6 days, yeah. So we have other business to do besides this, but we can certainly add this to that agenda, right, Penny?
Yes.
So
Then after
what-
that meeting, we can set a meeting out a couple of weeks after that.
Yeah,
maybe
so that would be 2 weeks after the the next meeting.
Yeah.
It
So
works for
maybe
me.
the 23rd or 24th. Yeah.
Yeah.
That week.
Do you want to set that meeting now or?
Yeah. Can we?
Sure.
The 24th?
Tuesday morning works for me.
I'm trying to look at the calendar. Let's see, that is the 24th.
Do you guys want to do the morning or you want to go back to the afternoon at 4?
I could do the afternoon or morning that day. I don't have any plans yet, so I'll work around whatever we decide to do.
Okay.
I
that
have an
would-
early
that would
morning.
The afternoon would help me being in the office, at the recorder's office. So 4 o'clock would be a little better. I wouldn't be missing as much work.
Either one for me.
There
I
is
will
a,
not be able to attend in the afternoon.
there is a county council meeting, just FYI, that begins at 5:30 on the 24th.
Shoot.
I could do Monday too, if Monday works better.
I could do Monday. I could do Monday at 4.
How about you, Mark? Does that work better for you?
Does that work for you, Margie? Also Monday, the 23rd, Penny, does that work for you?
Yes.
At what time? 4:30?
4:30?
Mondays are okay for me.
That works.
I won't be able to at 4:30 on that Monday because of class.
Does 4 o'clock work or?
Um, I have class at 4:55. So if it's just me, then
What about
proceed
3
without
o'clock,
me.
Mark? Could we do 3? Would you have enough time?
Yes, that's fine.
Part of it?
Yeah.
Okay.
Does 3 o'clock on Monday, the 24th work for everyone?
23rd? Is it the 23rd?
23rd.
23rd,
Yes.
3 p.m.
23rd, 3 p.m.
Works
And
for me.
George, you said yes. I'm sorry, George, you said yes.
Yes.
Okay. So Monday, August 23rd at 3 o'clock.
Got it.
Got it.
And I do want to caution everybody, we still are meeting a week from today.
Right.
And on that matter, I can tell you that I have drafted a staff
Actually-
report recommendation to send to you that I will be getting out to you shortly.
Actually, I have on my calendar for the 9th Monday, not a week from today. Is that correct?
Looking at the calendar, you're
Yes.
right, it's Monday.
So 6
It
days
is
from today.
Monday.
Okay, not a week.
Yes.
Okay, got it.
Yes. Thank you, Carol. Anything else we need to do today? I don't have anything else in my notes. Penny, is there anything else you think of that we need to do today?
I do not have
Margie?
any.
Okay,
I have a quick question though. Penny, would we be able to get the contract for the enforcement support to the commissioners by the next meeting? Not tomorrow. I know tomorrow they meet, but is it something that we can move that quickly on?
We'll certainly talk with the commissioners about that and with legal, and I would think that we should be able to, I would think that's enough time, but
Please get it in front of them. And yeah, okay.
okay, this meeting is then adjourned. I'll see you next week.
thank you.
Thank you.
Thank you.